Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Today I'll be discussing with you about spinal shock, about which you are aware. So, what is spinal shock? Spinal shock is when the spinal cord, so consider this as a spinal cord, there is an acute damage, maybe vascular, traumatic, or infectious. Below that level, all the functions, that is motor, sensory, autonomic, and reflexes temporarily gets disrupted because spinal cord carries the sensory impulses and also it carries the efferent or the upper motor neuron signals from above. So all are disrupted, and recovery of the spinal shock occurs to various stages, classically described as having 4 stages. So spinal shock occurs when there is an acute damage and recovery occurs over 4 stages. Let us look into what are the 4 stages. So stage 1. Stage 1 occurs in the first 24 hours. So this is the stage 1, or sometimes called phase 1, where there is complete areflexia. There is no reflexes, hypotonic. It imitates an element paralysis. So day 1, 0 to 1. So hypotonia, hyperreflexia, and weakness. So it imitates a element lesion. Then next phase is 1 to 3 days. So here what is happening? The polysynaptic reflexes start appearing. It is due to the sprouting of interneurons and denervation, hypersensitivity that is occurring. The first reflex to come is the bulbocavernous reflex. But the appearance of bulbocavernous reflex denotes the beginning of or the end of spinal shock stage. Then other reflexes will start appearing as mentioned previously due to the denervation, hypersensitivity, and sprouting of interneurons. This is during the next 4 weeks. So here the deep tendon reflexes appear, the tone starts increasing, then finally the phase 4. Phase 4 is up to 1 year or 12 months. So here the typical spastic paraplegia or quadriplegia develops. So the tone increases, the reflexes increases, the tone increases. So there is the patient was got a spastic quadriplegia or paraplegia. Clonus may be there. Autonomic dysreflexia can occur. There are different stages the patient is passing through, and the spinal shock stage may extend in certain situations like urinary infections. So today I have discussed about the spinal shock. It should not be confused with the neurogenic shock. The neurogenic shock is a hemodynamic problem occurring. That is, below the spinal cord transection, especially if it is above the mid-thoracic level or above T6, autonomic support is lost and patient may develop, especially the sympathetic support is lost, patient may develop bradycardia, hypotension, etc. So it's a hemodynamic problem. So spinal shock is a neurological problem and the neurogenic shock is a hemodynamic problem. So in the next session we will discuss about management of spinal shock. Hope it was useful to you. Thank you.